Welcome to House MD Uncertainties, because nothing says fun like watching House guess what rare disease is trying to kill someone this week. But hey, stick around and find out about the inaccuracies that plague our show. First, how the hell hasn't Dr. House suffered from a Vicodin overdose by now? Bro pops them like M&Ms. But on a serious note, the limit before someone suffers from overdose is 8 to 10 pills daily, which then would cause liver failure. Vicodin overdose symptoms include respiratory depression, liver failure from acetaminophen, and overdose death. His colleagues reported that he pops between 8 to 10 pills daily, yet functions normally. Overdoses happen easily since, especially for someone like House who's been using opioids for a decade, his body would build tolerance, which means more pill consumption for effects and sometimes to ease addiction, which equals overdose. Side note, while House did have hallucinations later on, which aren't a common symptom of overdose, but if it happens, it means that. The other symptoms listed should have occurred, but they don't, as hallucinations are a sign of mild overdose mixed with hypoxia to the brain and central nervous system. 2. Foreman's Lucky 11. Foreman's lucky encounter with Naegleria fowleri. Foreman somehow survived a brain-eating amobia. Precisely, Naegleria fowleri, which has a 98% mortality rate. It's deadly even in its early stages. Only a few patients have been saved due to experimental treatment, and the amobia being in its early stages. Foreman already exhibited the last of its deadly symptoms, so it was already too late. Add to that multiple random pills House gave him to try and cure him. Naegleria fowleri late-stage symptoms that exhibited in Foreman: delirium, severe confusion, loss of consciousness, coma, auditory and visual hallucinations, blindness, loss of balance coordination. Anyone surviving Naegleria fowleri in its late stages is medically impossible. Now as for number 3, Cameron and HIV. Cameron was splashed with HIV-positive blood and waited hours before starting prophylaxis. Am I surprised that happened? No. Anyway, the CDC recommends starting prophylaxis within 72 hours, ideally within 2 hours for maximum effectiveness. Delays decrease success rate. HIV prophylaxis involves strong antiretroviral drugs for 28 days, which cause nausea, headaches, and liver issues. Surprisingly, Cameron shows 0 side effects on screen, which is rare. HIV exposure often causes stress and anxiety in healthcare workers. Cameron seems unfazed and somehow returns to work at full speed. After her course of prophylaxis, she's portrayed as completely healthy, with no lingering health or psychological issues. In reality, HIV testing is done at 3 weeks, 3 months, 6 months, during which uncertainty can weigh heavily. As for number 4, Dr. Chase's medical blunder. Chase hesitated and failed to secure a patient's airway quickly after cardiac arrest. In medicine, every minute without oxygen increases risk of brain damage by 10%. His hesitation could have been fatal. He didn't strictly follow ACLS guidelines, such as continuous CPR cycles, immediate airway management, and drug timing, which compromises survival chances. Chase made independent calls without updating House or the rest of the team. In hospitals, communication breakdowns are a major cause of preventable errors. Despite suboptimal care and delays, the patient survives without long-term deficits. In medicine, patients with significant downtime often have hypoxic brain injury or other lasting complications. And lastly, Dr. Wilson's cancer survival. In the show's last season and episodes, Wilson suffered from stage 2 thymoma, and it took his life. The cancer is portrayed in the show as certain death if untreated, hopeless even with treatment. In reality, stage 2 thymomas have a 5-year survival rate of 80 to 90% with proper treatment. Wilson's immediate resignation to death is medically inconsistent. Stage 2 thymomas are treated with surgical resection, thymectomy, followed by radiation to reduce recurrence risk. If Wilson had agreed to the treatment, it'd given him long-term remission. Plus, Wilson is an oncologist himself, so he should be aware of the survival statistics and treatment success rates. His option to skip aggressive treatment in favor of quality over quantity, a life, is medically questionable. It's considered uncharacteristic decision-making for an oncologist. Done and done. But before you go, here's a House MD overview. House MD is a medical drama that follows Dr. Gregory House, a diagnostician who always craves mystery in search of answers, solving the most impossible medical cases with his diagnostic team at Princeton Plainsboro Teaching Hospital. Dr. House, head of diagnostic medicine, known for his brilliant problem-solving skills and unconventional, sometimes illegal methods of curing his patients and reliance on Vicodin to manage his chronic leg pain.